Interestingly enough, I am a fairly new, I would say new nurse leader in this realm. I've been around for quite some time, but very new in the realm of system nursing. I've done other system positions outside of nursing, and I've had the ability to be able to work with system CNEs, but this is my very first system CNE role. And I'll tell you, I think that we have to start thinking out of the box when it comes to strategies that can help with recruiting and retention. One of the things a story I always share is that when I was a bedside nurse, we would have a lot of beeping. The beep, beep, beep would be constant. And I heard that beeping when I was off the bedside for 2 years. I would hear that beeping still hear it just before I go to sleep because I was a night shift nurse. And when I think about strategies, I think that we have to think about that trauma and that impact that bedside nurses are experiencing, and think about potentially nursing sabbaticals so that people can recover from the trauma. The other thing I want to share is that nurses see death and loss and grief and really traumatic experiences at the bedside. And we expect them to just recover and come to their shift the next day and be okay. And we would never ask another human being to see something so traumatic and recover within 24 hours or even less than 24 hours, 12 hours, if they're working back to back shifts. So I think our retention and recruitment strategies need to focus on how do we improve the way we have well-being and workforce balance for our nurses. We have to think of more innovative ways to be able to recruit nurses to the profession, because I'll tell you, we're having a hard time doing that right now because folks don't want to work 12-hour shifts. So flexible scheduling is another opportunity. How can we have what we used to say back in the day, mommy schedules, so people can have the ability to spend time with their family, see their child's soccer game. When you work 12-hour shifts, you miss. When you work weekends and mandatory holidays, we miss. I think sometimes we don't think of the nurse as a human being, and we have to rethink that, because nurses have families too. They just sacrifice them to take care of ours.